So my name is Helen Miller and I am the Macmillan Personalised Care in Cancer Project Manager, and I work for the University Hospitals of Morecambe Bay. So my post is funded through Macmillan, but I work at the Trust and we help to deliver the personalised care element from the NHS long-term plan. So that incorporates holistic needs assessments, it incorporates making sure we're providing people with that personalised care to ensure that they are maintaining a good quality of life. We also ensure that they've got the information they need to be able to process what's happening to them from a cancer perspective, and that includes your end of treatment summaries and also health and wellbeing, which is why we organise the event on the 19th of April. What we're trying to do is make sure that our patients are able to access services not just within Morecambe Bay but in the community. We're blessed in this region of having lots of support for cancer patients, and what we want to do is to be able to celebrate that fact and to be able to make sure patients are able to access those services. Sometimes patients are reluctant to do that, and what we wanted to do was provide an area where we could showcase all of those services and be able to speak to people on the day, but also then to capture some of the images from the day, capture some of the interviews from the day, to be able to then share with patients moving forwards. From a national perspective, unfortunately we're getting more and more patients who are being diagnosed with cancer. But on the positive, we're getting more and more patients who are being diagnosed, treated and moving on and living well after cancer. And what we want to do is to ensure that our patients can live well after a cancer diagnosis. That would be making sure they've got access to emotional support. That would be making sure they've got access to health and wellbeing. So that would be promoting exercise, which improves their resilience in terms of being able to cope with the treatment. So, for example, chemotherapy, being able to withstand the treatment, which can be quite challenging. We're making sure that people are thinking about reducing their smoking, reducing their alcohol, improving their diet, reducing their weights if they need to be able to make them more resilient. And also, research has proven that by doing that, the chances of recurrence are less if you maintain a healthy lifestyle. So we want to give people access to that information. But also, it can be very lonely having a cancer diagnosis and treatment. And as much as a lot of people have got support from family and friends, it's very empowering to talk to other people who've been through similar things and to share your experiences. So again, we're blessed. We've got a number of support groups within Morecambe Bay areas, and we are really keen to make sure that people have access to that and that support. The day was entitled Supporting Cancer Patients with Health and Wellbeing, and we set out with the aim of trying to pull as many agencies together in one room so that patients could come along, and not only the patients but their families, the carers, and to showcase what we've got on offer in the area of Morecambe Bay. And I think one of the surprises from the day was actually the different stall holders were able to interact and network, and that was fantastic, and the vibe in the room was incredible. People sharing stories, sharing signposting opportunities, sharing what they're doing with other agencies, and hopefully we'll have a more collaborative approach moving forwards. We also had a staff event where we were trying to invite staff from areas who treat cancer patients but not necessarily work in cancer services, so maybe some of the nurses on the elective surgical wards, research and development, some student nurses, to come along and see what is available. So when they have a conversation with a cancer patient, they can say, well, have you thought about approaching Macmillan? Have you thought about speaking to Cancer Care? This is what our clinical nurse specialists do within the trust. Did you know we have cancer support workers who are a first point of contact for our patients? So that element of it also was really well received, and again that was something that we can build on moving forwards, because obviously there is an appetite for that. And I think one of the things that really my take home message from the day was that everybody wants to work together to make sure that we're doing the best we can for our patients, for our families, for our carers in our area.